I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Tuberculosis and infertility, they are very often talked about topic nowadays. What is it and how will it cause infertility in patients is what we are going to be discussing. Tuberculosis is a mycobacterium disease. Basically, it can affect your lungs or your stomach or any part of any organ of your body, and it affects that functioning of that organ. Now, in terms of infertility, because we talk about infertility, it can affect both male and female. It is more prevalent in female. According to ICMR, Indian Council of Medical Research, a survey has been done where it was seen that about 50% of infertile patients, means patients who are trying for pregnancy and they are going for infertility treatment, they have observed that 50% of such patients have been diagnosed with tuberculosis. So it's a very commonly occurring problem now, because in India it's a commonly occurring problem as well in the general population. So in infertile patients also this is occurring very commonly now. Now when it comes to women, it can affect the tubes, fallopian tubes, it can affect the uterus, the endometrium, or it can also affect the ovaries. So these are the areas in the reproductive section where it can affect. When it affects these parts, it is called as female genital tuberculosis. So this is a very common occurrence, like I said. How does it affect each part? If it affects the tubes, it could cause a blockage, or it could cause a problem in the environment, that environment which is very useful for the travel of egg and sperm inside the tubes. It could damage the endometrial lining. How can it do that? It can maybe cause improper blood flow to the endometrium. Maybe it can cause thin endometrium, because of which there is no blood flow, and therefore a fertilized egg or an embryo cannot implant there, and therefore it leads to infertility. In ovaries, it could lead to poor ovarian reserve, where it affects the ovaries and the number of eggs and quality of eggs are coming down. So this is what can happen. Now, out of the 50% that I talked about, 90% of women have a problem with their tubes. Out of 50% of the patients that are diagnosed with tuberculosis, 90% of them are having a problem with the tubes. About 50% are having a problem with endometrium, and about 30-35% have a problem with the ovaries. So this is the percentage that has been revealed by ICMR in their survey. So how do you treat it? Well, it's treated like any other tuberculosis disorder. Medications are given for about 6 to 9 months, after which the test is repeated, and we can see if the problem persists, and if it doesn't, then some time is given for the natural cycles and natural environment to get it better, and then treatment options are looked at. How is it diagnosed? How do you know? Well, basically symptoms are not many. Maybe you have scanty periods, maybe you have too heavy periods, maybe you don't ovulate properly, maybe your periods are far and farther apart from each other. So all these are small symptoms where you should get yourself checked. And this is something that a gynecologist will do when you're going for infertility. Basically, they will make sure that you do not have tuberculosis, only then they will take you up for other treatment options. When it comes to hysteroscopy, this is a very small procedure where a small biopsy is taken of the endometrium or the fallopian tube, and it is sent for PCR. It is a test where they diagnose whether you have TB or not, after which medications can begin. If you want to understand more, if you think you have been diagnosed with tuberculosis and you've gotten better and you want to now explore your options, or if you assume that you have and you want to clarify this issue, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.